What's the most effective way to deal with a toothache? Let's talk about it. Your tooth hurts, you can't get in to see a dentist right away, you're on TikTok for some reason right now trying to figure it out. What should you do? Number one, tooth pain is inflammatory pain. If it is safe for you to take, ibuprofen is your friend. Ibuprofen, that's Advil or Motrin. It's an anti-inflammatory pain medication. It's the most effective for most toothaches. You can also supplement ibuprofen with acetaminophen. Acetaminophen, that's Tylenol. The generic versions of these medications are the same as the name brands, so you don't have to spend extra money on name brands. There's no reason to do that. Anyway, if you're having pain when you're getting ready to go to sleep at night and you want to try to maintain pain control throughout the night, instead of taking ibuprofen for your last dose of pain medication for the day, take naproxen instead. Naproxen is in the same drug class as ibuprofen. It's an anti-inflammatory medication, but it has a longer drug half-life, so it stays in your system, working for a longer period of time. Aleve is the brand name for naproxen, but again, you can use generic over-the-counter meds. It's all the same stuff. So if you have a toothache, the most effective medication dose schedule to deal with the pain, if you are an adult patient, would be as follows. At 8 a.m., you take 400 to 600 milligrams of ibuprofen. At 11 a.m., you take 500 to 650 milligrams of acetaminophen. At 2 p.m., you take 400 to 600 milligrams of ibuprofen again. At 5 p.m., are you getting bored with this yet? You take 500 to 650 milligrams of acetaminophen. At 8 p.m., you take 500 milligrams of naproxen. Then you repeat that schedule starting again at 8 a.m. the next day. That's giving you 6 hours in between each ibuprofen dose. That's giving you 12 hours in between the naproxen dose and the next ibuprofen dose in the morning, and that's appropriately spacing acetaminophen 6 hours apart from itself. You gotta stick to the dosing schedule or you're just asking for trouble. So let's say you're taking all of the best over-the-counter pain medications that are safe for you to take, you're taking them at the right dosing schedule, you're still having pain. Right? What should you do now? What other options do you have? This is going to sound weird and possibly condescending or something. I don't mean for it to come across that way, but we do have this weird ability to modify the pain we are feeling with our own mind. That sounds made up, but it's real. It's real. The way we perceive pain ultimately is in our brain. Our brain has the ability to release something called endogenous opioids to counteract pain. You know, the whole opioid crisis that's wrecking America? Yeah, you know, people getting addicted to pain pills and overdosing, all those horrible things. We actually have the ability to release similar chemicals naturally in our own body to help reduce pain perception, right? You kind of already have some opioids on board. And I know it's hard, but getting more worked up about and anxious about the pain you're having only ever makes it worse, right? Whatever you can do to calm down and relax, that can have a beneficial impact in reducing your pain perception. So what's an easy way to help you relax? If you're anxious, you know, often your heart rate, blood pressure, breathing rate, all of those increase. What's the easiest way to counteract that? Weirdly enough, strange as it sounds, that would be to practice slow nasal breathing. You want to take about 5 to 6 breaths a minute. The goal is to breathe in for about 5 or 6 seconds and then breathe back out for 6 seconds or more. Ideally, you want your exhales to be longer than your inhales. You want to try to keep your mouth closed and gently breathe in through your nose and then back out through your nose. Also, the goal is not to fill the lungs all the way up. That's not important. What's important is slowing down the breathing rate. Slow in, slow out. Longer extended exhales compared to inhales. Ideally keeping the mouth closed throughout. I know not everyone can breathe through their nose, but if you can, that's what you want to do. Try it consistently. I know that sounds super weird, but try to focus on changing over to consistent nasal breathing throughout the day. Next time you get stressed out, you know, you don't have to have a toothache, you don't have to be in a lot of pain. Next time you're getting stressed, try to slow your breathing down. Focus on nasal breathing. Close your mouth. Rest your tongue gently to the roof of your mouth. See what kind of effect that has on how you're feeling. Okay, third thing about pain and toothaches. This one's going to be a little controversial probably, but I'm going to say it anyway. because I think it needs to be said. Sometimes pain is a useful signal. We evolved our capacity to feel pain for a reason. When our pain perception is functioning correctly, it's telling us that something is going wrong in the body. It's a warning, right? Canary in a coal mine. Weird as it may sound, try to be grateful when you feel pain. Consider it an opportunity to make a change before things get worse. It's a signal that something about the health of your body is out of balance. Now would be the time to make changes to your daily habits and lifestyle to improve your health, and then hopefully get rid of that pain signal. And that behavior change is really going to help you out in the long run. We made a huge mistake in America in thinking that it was healthy to obliterate our pain signals with opioids. I'm not saying there isn't a time and place to use those medications, but we overprescribed them and we're suffering worse for it now. You can't get rid of pain in life. Pain is a useful warning. You want it to be in balance, but you don't want to think that pain is always bad. It really can be a helpful signal about ways to change your life. So don't wish for pain to be completely gone for your life. Pay attention when you have pain and ask yourself what you could do differently that might stop that pain from coming back on in the future.